So the pandemic really brought pulmonary and critical care to the forefront. We were the clinicians caring for these patients. So with the recognition that COVID really brought awareness to inequities in healthcare, this was the right time to first launch the listening tour, hear how we could help our patients, and now the opportunity for the First 5 Minutes program to establish a relationship from the get-go with our patients that will be a positive relationship.
You know, healthcare can be so intimidating, and particularly low-income and minority communities often don't have really good healthcare. And there's generations of people who don't have good healthcare education, and that means that we've got to take a break, a pause, and listen to whether or not we're being effective in the administration of healthcare.
I feel like people are in a hurry. They can move fast, and I guess they think you can move fast too. And it's just not the case.
And so trust, I think, for me, has to be built on the consistency of a caring clinician who takes the time to listen and respond accordingly.
Trust with my clinician was really critical in my willingness to follow their instructions and to work with them.
For us as doctors, we go into a meeting with a patient thinking that we have trust, that it's understood. The patient understands that we're here to help them. But the reality is you have to earn that trust.
Any small cue that the physician gives off that is not welcoming, that seems distracted, that doesn't seem engaging, will turn that patient away from trusting that physician.
Trust is not something that's just granted. We have to earn it. And one of the nice things about the relationship-centered skills is it gives you some tools that are evidence-based and proven to help engender trust.
So that led to the idea of the First 5 Minutes, because if we can establish that trust and communication with our patient in the first 5 minutes of our encounters, that could potentially lead to a future lifetime of better health for that patient and better health outcomes. What we're hoping with the First 5 Minute workshop on June 18th in Bexar County is that we have the opportunity to train another 20 to 30 clinicians. And what we're hoping for is they feel very comfortable with the First 5 Minute program and teaching, and then they go back to their institutions or their hospital systems, and they in turn train others on the First 5 Minutes program.
The workshop went very well. I think it had a good mix of having some didactics on a PowerPoint with, at the same time, some demonstrations by the preceptors, and then also having some actual practice with some real-time feedback. I thought that was very good.
Today has been an eye-opening experience for me. Yes, I already know of several places I'll implement this in my own practice with patients in the clinic and in the hospital, but also I will bring it to medical students, residents, fellows. Maybe we should be teaching this from the beginning. Maybe we should relook at the way we start to learn how to see a patient.
Medical training is different. You are just task-oriented, and you get your HPI done, you get your information that you need, and you know you have to fix the problem without looking at it from the patient perspective and a relationship perspective.
So for patient outcomes, it kind of makes sense that the better we communicate with our patients, the better they do stuff that we ask them to do. And it turns out that the literature on patient outcomes supports that notion that if we are clearer about our communication, if we are more empathic in our communication with our patients, that in COPD and in asthma, they're more adherent to the medications. That talking to patients who have pulmonary nodules and or early diagnoses of lung cancer, that they have decreased feelings of anxiety because they have been effectively communicated with by skilled physicians.
We do different procedures in medicine. We learn, we practice, and we achieve excellence in performing those procedures. And communication is a procedure which we use the most commonly every single day in every aspect of our lives. And yet we just get the least amount of training and the least amount of practice.
Maybe this needs to go way back to where we, as experienced physicians, had learned, and say what needs to change in medical education, what needs to change in nursing education. That, I think, is where we have to go next, because I think that's how powerful this is.